I'm Colin Robertson. I'm Professor of Emergency Medicine at the University of Edinburgh in Scotland. I've had an interest in cardiac arrest and cardiopulmonary resuscitation for over 30 years now. It's always struck me that one of the cruelest things that can happen is that someone, often in the prime of life, can just be cut down without any warning. A cardiac arrest often occurs completely out of the blue. You can be walking along a path like this, you can be driving a car, you could be sitting in a house when it happens. There's a difference between cardiac arrest and a heart attack. When a cardiac arrest happens, the normal rhythm of the heart stops. It becomes often chaotic. The heart muscle can't pump. Blood can't circulate round the body, round the brain, round the rest of the body. And within a few seconds, the patient becomes unconscious. Without treatment, that patient will die. Their life has been cut short. Their family will never be able to see them again, and the tragedy is often immense. Two things have been shown to improve the survival from cardiac arrest. The first is cardiopulmonary resuscitation, principally chest compressions. And the second is that for a proportion of people in cardiac arrest, what happens is that the electrical disturbance is called ventricular fibrillation. The heart muscle quivers. It doesn't pump blood appropriately. And these patients can be saved by the use of a defibrillator. A defibrillator is a small electrical machine that gives a special form of electric shock which can restart the heart. And we know that the quicker that shock is given, the greater the chances of success and of that patient returning to their family and to their previous life. But defibrillators are often few and far between. It's been shown that if you're within 100 to 150 meters of a defibrillator, your chances of survival are massively greater. But in the past, defibrillators have been big machines. They've been expensive. They've needed expertise to employ them. And now that is no longer the case. We have the ability now to use defibrillators that are small, that are simple and safe to use, and they're cheap. These defibrillators can be used anywhere. They can be used in the home, they can be used in the street, they can be used in schools, sports grounds, offices, everywhere. And with these machines, appropriately applied, a good proportion of patients who've had a cardiac arrest in ventricular fibrillation can be saved.